infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, trachoma is the leading infectious cause of blindness worldwide. This bacterial, neglected tropical disease is targeted to be eliminated as a public health problem in 2020. Now, my guest today says in a post in the blog BugBitten that the future looks bright for trachoma elimination. So joining me now to discuss trachoma, the elimination strategy, and the successes we've already seen is Cara MacFarlane, PhD. Dr. MacFarlane is with the Cochrane Infectious Diseases Group and the Countdown Consortium at the London School of Tropical Medicine. Dr. MacFarlane, welcome to the show, ma'am.
Hi, Robert. Thanks for having me on the show.
You're more than welcome. Now, I suspect that some of the audience may not be familiar with trachoma, as it doesn't get a whole lot of press in the U.S. or elsewhere. So before we get into the strategy and why you say the future looks bright for elimination, can you tell us, what is trachoma?
So trachoma is an eye infection caused by the bacterium Chlamydia trachomatis, and it is the leading cause of preventable blindness worldwide. The infection is spread when people are exposed to eye or nose discharge from infected people, such as through contaminated hands, clothes or bedding, or by flies that carry the disease. Young children are the main infection reservoir, and active trachoma is common among preschool-age children in endemic areas. So the World Health Organization uses a grading system to classify the symptoms of trachoma, or the clinical signs of disease. The early stages of disease involve inflammation of the inner eyelids as a result of repeated infections with the bacterium. With repeated infections over several years, recurrent inflammatory episodes can cause the inside of the eyelid to become severely scarred and eventually cause the eyelid to turn inwards. This stage is known as trachomatis trichiasis, and it is caused by the eyelashes rubbing on the eye. This causes scarring of the eyeball and it can be very painful. If this stage is not managed with surgery, it will result in irreversible blindness. The blindness from trachoma is related to the intensive infection transmission in the community, but typically occurs in people who are between 30 to 40 years old. Blindness is also more common in women than in men, and this is probably due to frequent contact with infected children.
So, Dr. MacFarlane, how many people are affected by this disease globally? And where is it most commonly found geographically?
So trachoma causes blindness or visual impairment in around 1.9 million people worldwide, and about 1.4% of all blindness is due to trachoma. So earlier this year, the World Health Organization reported that 158 million people live in trachoma endemic areas and are at risk of blindness. People are also affected by the loss of productivity caused by trachoma, which is estimated to cost $2.9 to $5.3 billion annually. The trachoma is currently considered to be a public health problem in 37 countries. It's hyperendemic in many impoverished and hard-to-reach areas of Africa, Asia, Australia, Central and South America, and the Middle East. And Africa is the most affected region, with 22 countries known to require interventions for trachoma. The disease thrives in crowded living conditions, where there are shortages of water, inadequate sanitation, and poor hygiene, and where numerous disease-spreading flies are present. Infection is usually acquired through living in close proximity to others with active disease.
Okay, about a quarter of a century ago, the World Health Organization adopted the SAFE strategy to prevent and treat trachoma. Dr. MacFarlane, what is the SAFE strategy?
So the SAFE strategy is an integrated approach recommended by the WHO for the control and elimination of trachoma. SAFE is an acronym for the four main interventions, which are surgery, antibiotics, facial cleanliness, and environmental improvements. So for people with trichiasis, surgery is needed to return the eyelids to normal positions and prevent blindness. Antibiotics are used to prevent trachoma from developing to the more advanced stages that will require surgery. Azithromycin is an antibiotic that has been freely donated to treat trachoma since 1999, and the WHO recommends annual mass drug administration to all endemic areas at risk, which is known as preventive chemotherapy. But the S&E components of the SAFE strategy, promoting good hygiene and improving access to water and sanitation, are important, as poor hygiene and dirty conditions facilitate transmission. To promote hygiene and facial cleanliness, the WHO supplies facial kits, which include a face towel and soap, while the main environmental intervention is the hygienic disposal of human waste, as the flies that transmit the bacteria preferentially lay their eggs on human feces.
Now, on my website, OutbreakNewsToday.com, I've reported on several successes in just the past couple of years, including Cambodia, Laos, Nepal, and Mexico. Dr. MacFarlane, can you elaborate on these successes and any other countries that have seen the same successes?
Well, as of the 16th of October this year, 12 countries reported achieving elimination goals, which signifies a major milestone in the campaign to eliminate trachoma. 8 of these countries, including all that you've mentioned, have been validated by the WHO as having eliminated trachoma as a public health problem in recent years. So Nepal is the first country in Southeast Asia, and Ghana is the first in the WHO's African region to achieve this. So the progress is encouraging, and I'm sure we will continue to see these countries' success stories. Africa is currently receiving the most intensive control efforts, with over 226,000 people given operations, and more than 79 million people treated with antibiotics in 2017 alone. Other successes have also included the launch of Yemen's first mass treatment campaign earlier this year, which targeted around 450,000 people, and this was implemented despite continuing civil unrest and instability in the country.
Now, in your post on BugBitten, you're very optimistic. Dr. MacFarlane, in your view, to you, why does the future look bright for trachoma elimination?
Well, the number of people at risk of trachoma blindness is continuing to decline as a result of the SAFE strategy. The estimated number of people living in endemic districts and at risk of blindness has been halved since 2010, declining from 317 million people in 2010 to 158 million people in 2018. In 2017, 231,000 people received operations for advanced disease, and 83.5 million people received antibiotics. Global level antibiotic coverage for trachoma has also increased by 30% from 2015 to 52% in 2017. These numbers, and the fact that 3 countries have achieved elimination this year alone, I think is showing a very promising trend. So the WHO's Alliance for the Global Elimination of Trachoma by 2020 recently published its action plan describing what must be done to scale up trachoma initiatives. And so I think with the targets and the strategy and the action plan set, global elimination of trachoma will hopefully be made a reality in the near future.
Okay, finally, any final thoughts about trachoma, the elimination, or any related topics?
Well, trachoma elimination is an ongoing success story. However, there's still much progress to be made. Efforts need to continue and intensify, and this means improving coverage, enhancing intervention strategies, linking multiple sectors, and obtaining the necessary funds. And I think particularly important will be the full engagement of sectors involved in water, sanitation, and socioeconomic development in order to sustainably break the transmission cycle of the disease, and then we can achieve the global elimination of trachoma, a public health problem.
Very good. Now, it's a very interesting article, and I will post a link to it on the website when I post the podcast. And I encourage everybody to check out this blog called BugBitten. Very, very good stuff. And I want to thank you, Dr. Cara MacFarlane, for your time and your expertise, ma'am.
That's great. Thank you for having me on, Robert.
You're more than welcome. Thank you.